In 2001, a national coalition of organizations got together and created a planning document for increasing physical activity in adults aged 50 and over. Representatives included AARP, CDC, American Institute on Aging, American Council on Sports Medicine, and American Geriatric Society. The goal was to identify barriers to physical activity and figuring out strategies for dealing with it. All of these organizations realize that physical activity is key to extending an active, independent life, reducing disability, and improving the quality of life. The Department of Health and Human Services in the Healthy People 2010 report notes that 70% of illness is preventable. Other research shows that 70 to 90% of illness is due to stress, all of which can be addressed by physical activity. So fast forward to 2004. The National Council on Aging, which in itself represents over 3,500 individual and organizational members, asked the Institute of Integral Qigong and Tai Chi to carry out a trial program for introducing physical exercise to older adults using Qigong and Tai Chi. Note that they didn't choose low-impact aerobics and they didn't choose yoga. That's because there's growing evidence that Qigong and Tai Chi are the best forms of physical activity, especially for older adults, because they're low impact, they're low cost, and they're very easy to learn. So in 2005, because of the success of the trial program, the Blueprint Office, the National Council on Aging, and the Institute of Integral Qigong and Tai Chi called a national expert meeting at the University of Illinois. The experts consisted of lineage holders and masters, government agencies, community organizations, Western medical professionals, Qigong and Tai Chi practitioners and teachers, and complementary and alternative medicine practitioners. The goal was to create a Qigong and Tai Chi consensus report. The National Expert Meeting on Qigong and Tai Chi Consensus Report contains the outcomes and expert recommendations of the meeting. A few of the highlights are: course content consists of movement, self-massage, meditation, and breathing. Classes are group activities that provide ample opportunities for social interaction. The experts concurred that there's a need to train basic-level lay leaders who can provide introductory Qigong and Tai Chi programs. Qigong and Tai Chi programs can be beneficial for everyone, including people who are chronically ill, frail older adults, and those with disabilities, especially since Qigong and Tai Chi can be done sitting, standing, or lying down. Their consensus recommendations are useful to assist organizations, agencies, and facilities in developing and implementing mind-body practice programs.